Frustration can really feel overwhelming if you've tried every recommendation to control diabetes, from nutritional discipline, exercise therapy, medication adherence, and weight loss programs, among many others, yet your blood sugar keeps worsening. For many patients, this is exactly the stage at which we always begin advising on advanced treatment options such as insulin therapy. If this is your reality, then worry not, because I bear a message of hope to you. Around the world, bariatric surgery, also known as metabolic surgery, is a fast-growing game changer in the management of obesity and type 2 diabetes. A major meta-analysis published in PubMed involving 7,883 patients found that 89.2% or more of the participants achieved improvement or remission of diabetes. A further 64.7% of the patients experienced complete remission. A separate study published in the Journal of American Medical Association found out that bariatric surgery is 18 times more effective than non-surgical interventions. Despite this significant progress, it is important to emphasize that remission is not cure, and follow-up is still essential to achieve better health outcomes. My name is Regan, a medical clinician and a clinical researcher with a focus in diabetes, metabolic health, and emergency medicine. In my daily practice, I manage and follow up patients living with diabetes and other chronic conditions. So what I'm sharing with you is not just theory, but real practical experience from the front line of patient care. If you're serious about understanding your health, preventing disease, and practicing smarter medicine, please hit the subscribe button now and join this community. In this video, you'll learn about bariatric surgery and how it works in type 2 diabetes. Let's get into it after the short introduction.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho. Moyo wa mwanadamu hukumbuka raha ya jana na kusahau utumwa uliomkaza kwa kamba, kwa sababu ya hofu ya kesho isiyoonekana. Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.
So what is bariatric surgery? Bariatric surgery or metabolic surgery is a surgical intervention that helps individuals lose weight by modifying the digestive tract. The procedure usually serves to restrict food intake and reduce nutrient absorption, or both of the two, depending on the surgery that has been performed. The following are the most common bariatric surgical procedures. First is sleeve gastrectomy. This procedure usually involves the removal of 75 to 80% of the stomach, and it leaves a narrow tube-shaped stomach that is called a sleeve. When that bigger portion of the stomach is removed, then it is believed that you'll not be able to take more food as you've been taking, and even absorption will reduce, and this practically reduces absorption. That means that weight will also go down. The second type of bariatric surgical procedure is the gastric bypass, also called the ROX NY. This one usually reduces the stomach to a very small pouch, and it also reroutes part of the small intestine, and by doing this, it limits both food intake and food absorption. The third type of bariatric surgery is the biliopancreatic diversion and duodenal switch. It is the most complex surgical procedure I've had, and it includes both significant stomach reduction and an intestinal bypass. Although it produces significant weight loss outcomes, it carries nutritional risks that must be closely monitored. And the last bariatric surgical procedure I'm giving you today is the gastric band, the adjustable gastric band. In this procedure, a band is usually placed in the upper gastric wall to limit food intake. The procedure is less performed today because of lower long-term success rates. I've seen most of us in Kenya do this. It's the most common one I've heard about. Personally, if you want to do bariatric surgery, if you're considering any of the options listed, then worry not. I'll do an eligibility criteria for bariatric surgery in my next video. You don't want to miss that. As of now, let's talk about how bariatric surgery improves type 2 diabetes and enhances weight loss. Bariatric surgery improves type 2 diabetes and enhances weight loss through the following mechanisms. Number one is hormonal changes. Surgery usually alters hormones in the guts, and those hormones are such as ghrelin. We talked about it in the circadian rhythm. You can also go back and check about that. Peptide YY is another hormone, and GLP-1. We'll discuss about this in the next video. Again, you don't want to miss that. Bariatric surgery also improves insulin sensitivity. It improves beta cell function, and lastly, it reduces adiposity around various organs. By doing all this, it improves type 2 diabetes and of course enhances weight loss. We'll discuss more about this in the next video. In my final thoughts, metabolic surgical procedures have transformed the treatment landscape of weight loss and type 2 diabetes related to obesity. People struggling with poorly controlled diabetes and obesity can now access bariatric surgery as an evidence-based treatment option for improving both metabolic health and the quality of life. If this video gave you clarity, if it challenged how you think about modern management of diabetes, please subscribe now, because this channel is all about helping you stay ahead of the disease and not reacting to it. Share this with someone who may need it, because you might just change their life. Diabetes doesn't start in the emergency room. It starts silently, and the earlier you look, the more you can change the outcome. Thank you.
Lakini jangwani si mahali pa kuangamia, ni darasa la mbingu la kutuponya roho.